Hello, today we are going to learn how to set up this ParaPAC MRI vent. On this vent you have a oxygen tubing that connects to the vent, and the other end connects to a O2 outlet or a O2 tank which has at least a minimum of 40 psi. Next we have corrugated tubing that we will cut with scissors according to the length that we desire, that we can have reached towards the patient and the MRI vent safely. Once your tube is cut, you will attach it to the ventilator on this side, and no filter is necessary. On the other end, we will attach an expiratory filter, the exhalation valve, which are placed in this bin right here. When you open up the contents, you will have two things: a PEEP valve and your exhalation port here. The PEEP valve attaches in only one area on this exhalation valve. And please make sure you have your PEEP set at the right amount that the patient has ordered on the ventilator. And it's a little hard to see, but it mentions where to attach the PEEP adapter as well. Next, we're going to attach the corrugated tubing to the exhalation valve. Once this is done, this is what it should look like. And this end here goes to the patient's ET tube. So we have our endotracheal tube, and we are going to attach it to our MRI vent circuit. Please note that there's an arrow pointing towards where you need to attach it to the patient. If your patient is expelling a lot of secretions, you can attach the MRI vent to the patient's ballard as well. Once it's attached, this is how it would look like. And now we're going to show you something that can easily go wrong, and that is if someone were to attach it this way. Please note that we have our patient area attached to the corrugated tubing that goes to the vent, and this is not the correct way to set it up. This would be the correct way to set it up, where the patient arrow is indicating to have it connected to the ballard system. Next, before you apply this to the patient, you must make sure that your settings are appropriate, your rate, your tidal volume, your O2, and then you will be able to adjust your peak pressure once you're attached to the patient. Once your settings are appropriate, you can turn it to the on position and it will turn on, and you can only deliver 50% or 100% FiO2. And this is your patient who is set up currently on the transport MRI vent, which you can use for MRI and short transports to CT and back. Once you are done with your transport, please be sure to bring the MRI vent back to the department. Make sure you clean it before you leave the patient's room. As for the circuit, if you anticipate going on any more trips, you can leave the circuit in the patient's room in a bag. And this concludes our setup on how to set up the MRI vent at Advocate Sherman Hospital. Thank you.